Should we turn off our cameras, Gruba, or?
No, it's fine. All right, so we're streaming now. So, hi everyone, welcome to our second virtual shadowing session. And today we're going to be having Dr. Shah, a general dentist, speak to us a little bit about general dentistry. So, let me just open up her slides. Hi, Dr. Shah. Thank you so much for joining us today.
How are you doing?
I'm good. Thank you for having me. I hope that this is informative and, you guys can ask me any questions towards the end of the
Anytime.
presentation and we can kind of just play it by ear.
Thank you.
And,
Sounds good.
okay. So I know this presentation is called The Path to Dentistry, but it's more so my path to dentistry. Everyone has a different journey and, it's all about your end goal. So this is my full name. You can call me Helly, doesn't really matter. This is my email address. It's my personal email address. Feel free to email me if you have any specific questions about anything at all. I'll try my best to help you. This is my quote unquote like doctor Instagram where I just like post like cases that I did and you guys could DM me on that too. I'm not as active on Instagram as I guess people of your age, but I try as much as I can. Okay. All right. So a little bit about me. I had a pretty non-conventional path. I pursued biomedical engineering. I really wanted to do engineering when I was growing up, and I picked biomed because I loved like science and math and all of that. So I graduated in 2012 from Drexel University. But towards the end of my college career, I kind of decided that I wanted to pursue dentistry. I didn't know what to do. So I kind of just tried to get in touch with dentists in the area and I started shadowing towards like my junior year. And then I also did some research in an oral biology department at UMDNJ, which is now Rutgers in Jersey. I did that for about 6 months just to kind of like understand like the scientific aspects of dentistry because I didn't take like my prerequisite courses because I was doing my engineering and I just decided to kind of just finish that degree and then kind of take it from there. So then I did a 2 years master's program at Rowan University, which also was UMDNJ back in the day, but now it's Rowan. I don't know. Jersey does like weird things with their schools. Um, and that was a time when I really started taking like all the prerequisite courses. I was studying for the DAT. I was still in Philadelphia because the school was in South Jersey. So I got a position to do research at the University of Pennsylvania's perio department. Periodontics is basically just like, learning about like gum disease and all of that. So I kind of tried to understand dentistry at the scientific level because I figured might as well. I didn't know when else I'd get an opportunity like that. And as soon as I finished my master's, I had multiple interviews for dental school, and I decided to accept a position at LECOM, which is a newer school, but I don't regret it at all. It was really a good experience. I was a third graduating class, so it was fairly new, but the facilities were beautiful. It's an amazing dental school. And I feel very proud to be a part of that. And I graduated in 2018. And towards my last year, I was thinking like, what do I do? Do I work in private practice? Do I think about like a partnership? Am I like experienced enough to start my own practice? And the more and more I thought about it, I realized how much I love learning. And I also realized how much I didn't know in dental school. Like, it's different. Like what you learn in school and real life, it's a little bit different. And they kind of try to prepare you for the real world in dental school, but the real world is very different. So I actually decided to do a general practice residency program, and I did that at New York Presbyterian Brooklyn Methodist Hospital. I loved it so much. I got selected for a second chief year. So I actually did 2 years of general practice residency, and it was great. The second year was amazing. I got to pick my own schedule. I got to pick my own cases. Like the sky was the limit. I could do like anything that I wanted to. And that was really great. And I actually graduated residency. Um, June 30th of 2020, but I still had my license after my first year of residency. So I was doing this thing called moonlighting where I was in residency Monday through Thursday for like 10-hour days. And on the weekends, I was working in private practice. So I figured like that was the best way for me to like transition out of the academic world and kind of get my feet wet in private practice.
That's really interesting. I've never heard of a 2-year general dentist residency.
Yeah, some places have it, which is really nice. My typical schedule, okay, dentistry is hard, so don't judge me for working 3 days a week, but they are long days. They're like 10-hour days. Honestly, I work and I don't get that many breaks. I start my day around 8 o'clock and I'm officially done at 6, but I usually don't get home till 7:30. So they're pretty long days. And I do like 1 to 2 Saturdays a month. It's like you're kind of working like 3.5 days a week. But you can pick, your schedule. I have friends who work every day, but shorter hours. Monday through Thursday schedules, you can basically pick whatever you want to do. I mostly do restorative dentistry, which is like fillings and crowns. I do root canals. I do extractions. I've started to do Invisalign, but I would say the most important thing that I learned in dental school and residency is diagnosis and treatment planning. Like if you can't diagnose a patient and you can't communicate to them what their problems are and help them understand what they need in terms of treatment, like it doesn't matter clinically like what you can or can't do. So that is so important. And if you do decide to pursue dentistry, you will be doing so many treatment plan presentations in front of patients and really learning how to talk to them. And it's really important. And I didn't realize how important it was until I started working in private practice. Because if your patients don't believe what you have to say and they don't accept treatment and they don't really understand and you can't connect with them, like they're not going to come back. So that's just the reality of general dentistry. You don't see it as much in other specialties because you go to specialists because you need to go. And general dentistry is a little bit different. I generally see around 8 to 12 patients a day. That's including procedures, exams, hygiene, if I need to do hygiene, like things like that. So pretty fair schedule, nothing too crazy. So I'm just going to go over some like pros and cons of being a general practitioner. I definitely think there's more pros than cons, but I just tried to think about like day to day and like what some negative aspects of it could possibly be. It is very nice to be able to build confidence, not only to your patients, but also in yourself. Like when you can make a difference in a patient's life, and I'm not like trying to like preach or anything, but it's true. They will love you forever. And restoring smiles, like that is just, it's amazing. Like I'm sure if you guys are on Instagram and seeing all these like fancy dentists that are posting like before and after, it's like, oh my God, like this is amazing. Like I do that myself. I'm like in awe, like, wow. Helping patients eat better. I mean, that's so important. Like if patients don't have back teeth, like how are they going to chew? And, it's all about function and aesthetics, and you're the one that's able to provide that to them. So it's great. It's a great career. I put money under pros with question mark because a lot of people ask me like, you're a dentist, you must be making bank, you must be super rich. It's not true. You make a really good living, but there are a lot of careers out there, especially now, where you can study half the amount and still make as much as an entry-level dental associate. And I'm just going to put that out there because it is a common misconception.
It's an important consideration.
Absolutely. Cons. So there's a lot of patients that come into your chair. Just think about yourself. Like when you have a dentist appointment, like, are you excited to go? Like, mostly not. I mean, I'm not even excited about it. People don't really like going to see the dentist. Every single patient, I would say 75% of my patients, when I entered the room, they're like, Doc, I'm just going to let you know I hate the dentist. Like, that is how your introduction will be most of the time. And you just have to take a deep breath and be like, you're not the first one, and we'll get through it together. But like, you're not liked. It's already like, you know, one of those things where you're trying to be liked, but they're already in your chair, like not wanting to be there. So something to consider. You get better at it though, for sure. But, you know, in the beginning, it could be a challenge. If you do not have your own practice, autonomy can be an issue sometimes in terms of treatment planning. Like your schedule might have procedures that you didn't plan, and someone else might have planned them, and you may not agree with it. And most places are pretty good with like understanding, you know, your thought process with things, and but you just want to really be clear that you're not just doing things because they're in your schedule. You're doing them because you genuinely believe that they should be done. Associateship, you know, you get so used to using specific instruments, supplies, all this stuff in dental school or residency. You know, you're so used to things being a certain way. And then you work in an office that doesn't even have half the materials you use. They have very new, very different things. You have to, there's a huge learning curve. So, you know, that could be a con. But, you know, I think honestly, the cons are pretty short term. It's more of an adjustment thing. It's not so much like a long term thing, you know? So there are some cons, but I don't think, you know, they're that bad.
That makes sense.
Okay. So why did I decide to choose to be a general practitioner? And the biggest reason was so that I could do as much or as little as I want to do. I want to be able to pick and choose like the cases that I do. You also get exposure to a little bit of everything. If you want, you can be a dentist that just does fillings and crowns and you refer everything out. Like and you can make a good living doing that. Or you can try to push yourself and try to do a little bit of everything. And that's also an option. So it's very flexible. And the technology, the education, the CE, everything is growing so much with dentistry that like general dentists are placing implants. They're doing so many things that back in the day only specialists were able to do. Another thing is, you know, you could refer things out. And also, when a patient's expectations are super high of what they want out of a treatment option, you could refer that to a specialist. So I kind of like having that separation. Usually, when I do an exam, I just get a feel for the patient and what their expectations are. And it's all about knowing your limitations. That is the most important thing about general dentistry. You need to know your limitations. And if I feel like I will not be able to deliver on what the patient wants, I will usually refer them out. So those are just a couple of points to keep in mind. Okay. The future of dentistry. I cannot stress this enough. It is so crazy how advanced the technology has become with general dentistry and all types of dentistry. You may recall like way back when you were young, you were getting x-rays where the dentist put like a film in your mouth and they went and like developed it and like showed you on a little screen, and like I don't even know how to use that. I barely can interpret it. And in dental school, we only had digital x-rays. And the top right is a picture of digital x-rays. They give less radiation to the patient, which patients are thrilled about. They're instant. You take the picture and it's right on the screen. Like you don't have to waste time like developing films or anything like that. It's so good for patient education. You can like make these really big or show them on a screen, show them on a TV screen, and the patients can understand what you're talking about. So that's amazing. The bottom right picture is an intraoral scanner. Also amazing at teaching patients like what is going on in their mouth. It's like a camera. Basically, you just put it on a tooth, you take a picture, and the patient can see it on the screen. And it's such a valuable educational tool. And I'll be honest, I never used this in dental school. So I really hope that dental schools are implementing it more now, because there's a huge learning curve to all of this. But it's so, so important. The left picture is a CEREC machine. The left side is the scanner with the monitor, and the right side is a mill. Nowadays, there's this concept of one visit dentistry, where if you're getting a crown, the doctor will prepare the crown, like shave off the tooth, scan you, and literally mill your crown, and it's in your mouth in like less than 30 minutes, and you leave with the crown the same day. This technology is seriously amazing. I just started at an office that uses this, and I want to cry every day because it is so hard. And I really hope that all dental schools are implementing this in their curriculum, because I guess it wasn't as popular when I was in dental school. So, we didn't do it. But this is the future of dentistry. And if you were at a dental school interview, I would ask them that question. I would ask them, like, what type of technology are you implementing in your school? It is so important. And I think they'll be impressed. You can ask them, like, do you guys have a CEREC? And they'll just be like, what? So it's, it's like one of the most like cutting edge. The CEREC is not old. It's actually been around for 20 years, but now it's being used by, I would say, like 1 in 3 dentists are using it. And it's going to keep going up. By the time you guys graduate, it's probably going to be the standard of care. So definitely super, super cool. Okay. When I was thinking about, what I'm going to do after I graduated, a lot of my friends were considering accepting a position at a corporate dental chain. And a lot of my friends went into residency, either for general practice or a specialty program. Very few of my classmates got an opportunity in a private practice straight out of graduation. And it's really because, the experience isn't there. They're smaller practices. The practices have been going on for so many years, and they don't want to take a chance with a new associate, rightfully so. So when I discuss corporate dentistry, I honestly don't really have an opinion towards it. I just know some facts that I've heard. One major fact is when you graduate dental school, the average dental student is probably going to be in either in $250,000 to $500,000 of debt if you take student loans, which most people do. That's honestly the reality of dentistry. When you join a corporate, they will give you a sign-on bonus. They will give you all your benefits, and they will give you a way more competitive pay than a private office will. And those are all facts. The day you graduate dental school, that following month, you will start getting checks, like payment slips for your loans in the mail. Like, you need to start paying your loans off, and they are not cheap. So I honestly don't blame people for joining corporate dentistry. Some things about it, though, they are large corporations. They could be small too, but most of the ones that I've heard of, they're pretty big. They just take over dental offices and they control all the administrative aspects. There's a human resource person. There's a hiring manager. There's owners, and the owners are usually not dentists. And it's may also be like a group practice where there's a general dentist, and then there's an orthodontist, and there's an oral surgeon, and an endodontist. Everyone's under the same roof. So the patients may go there because, it's way more convenient for them. And, they have largely, honestly, taken over most states, especially Florida. Like, all my friends who are in Florida still, they're working corporate, and they don't not like it. I mean, they've stuck around for a while, so it's not something that they are unhappy with. They just look at their loans and they're like, if I could just get this experience and pay my debt off, it's a win-win situation. And I totally agree with that. So another reason that corporate dentistry is thriving, besides the student debt that everyone has, is you get a way better work-life balance. Like, You go in, you do your job, and you leave. Nobody is calling you in the middle of the night. You don't have to give your phone number to patients. Like, nobody's harassing you. You have no headache with scheduling. You have, like, your assistants will do everything. Like, your hygienist will be there. Like, it's very well run. It's like, like a corporation. Like, there's different positions for different people, and their job is really to just make your life easy. So it's pretty good. When I was moonlighting in residency, I actually worked for like a really small corporate. They only had one office, and I loved that job. Like, I really did. It was very seamless. They definitely do a great job at like making sure your life is easy. And again, like I said, they generally compensate more generously than private practice. So again, if you have loans, then it may not be a bad option. And one thing I want to say is, I don't have my own practice, but I have been hearing from a lot of practice owners that insurance reimbursements are declining. So when something like that happens and you have your own practice, your overhead starts to kind of get screwed up a little bit. So that's another reason I think why people may choose corporate dentistry, or why corporate dentistry may be thriving, because, you might just want that mindset. Like, I just want to be an employee, do my job and go home. Like, I want to do dentistry. I'm a dentist. I'm not a business person. I'm not like, and some people may want their own practice because that's what they want to do. So there's honestly pros and cons to both. I'm sorry, guys. Okay. So, advice for pre-dental students. There's a couple things here. Shadow a dentist who can mentor you. Like, the one mistake that I made was I was shadowing. I would like kind of zone out. Like, I didn't really know what I was doing. I feel like I shadowed just to get the hours in, but that was not a smart move on my part. You kind of want to see if you can even be like a little dental assistant and try to really get in there and suction and see what they're doing. If the doctor is doing lab work, go see the lab work, go see lab cases, like try to understand terminology, just the little things that will make you feel way more comfortable once you start dental school. And then once you decide to pursue dentistry, definitely do not give up. Like, apply with the full package. I'll always have people who'll be like, oh, like, my DAT score is really good, but my GPA is low. I think I'll be fine. I'll get in somewhere. And like, I'm always just like, why take that chance? Like, just try to get the good GPA, the good DAT, get the extracurricular. So you're a strong candidate and you have the upper hand. Don't try to just settle for like any school that will take you. Because sometimes, like, even if you get like a couple interviews, you may not get it. And then you're going to retake your DAT anyway the following year. So it's like, well, what was the point of all of that? So definitely try to do as much as you can. I know it's a very annoying test. I went through it. I took it twice myself. I hated every moment of studying for it. But, you got to do what you got to do. And then you'll never look back. Like, I don't even remember what the sections are on the DAT anymore. Again, do it for the right reasons. I talked about this earlier. Dentist is not equal rich unless you just get really lucky and you're one of those big guys, which is great. Good for you. But the average dentist usually will just make, like an average doctor salary. Understand that it is a lifelong commitment. Like, from the time I started dental school till now, I have changed the way I do so many things just because everything is growing and everything is so different and the technologies are different. There's like literature studies that are questioning things that we've been doing for like 10, 20, 30 years. It's crazy. So you really want to be on top of that because you want to provide the best care for your patient and you don't want to just get stuck in your ways and like not learn. Also, to have a license, you need to take certain amounts of CE every year. So might as well do the CEs that you think will benefit you and your patients the most. Apply early, of course. That's like literally the biggest thing. A lot of people don't apply on time. And have mentors a few years ahead of you so they can guide you. So, I always think about it this way. I have colleagues who I love to death, but they are going through what I'm going through. So they're very good vent buddies, and it's like fun to just like talk about how crappy our days were. But I also have friends who are dentists who are 2, 3, 4 years out. And they're really the people that will sit down with you and be like, look, like, this is what I would do, and this is why. And I was in your shoes a couple years ago. I know how you're feeling. It's way more constructive. So definitely try to find that. Okay. I'm going to go over some case studies. I will try my best to kind of simplify things. But again, like once we have a Q&A at the end, you guys can ask me more specific questions.
Sounds good.
So this is my patient, and I did this case. First of all, I'll be very honest. I never expected myself to do cases like this until I was like 5, 6, 7 years out. I did this like within 2 years of like not even like a year after I graduated dental school. So, you know, it's definitely a very good idea to do a general practice residency if you can. So I had this 60-year-old female. She lost some of her front teeth from an accident. And, you know, she was kind of limited in terms of finances. And the top picture here, this is kind of what she looked like beforehand, because I had study models from like way before. Because when she broke her front teeth, we kind of had to give her something temporary to kind of hold on, you know, just so she wasn't walking around without any teeth. So this is actually a temporary bridge, but this is based off of what her teeth started off with. And so what we did is we did a bridge from this tooth here to this tooth here. And realistically, her bottom teeth are very flared out, and it's kind of difficult to make the appearance look very natural if you're just fixing your top teeth and not the bottom. But that's all she could afford. But I think the lab honestly did a really good job with like trying to keep her bite in the same spot, but also give that feel that there's no cross bite and she's like biting normally, even though her lower teeth are a little flared out. And she was well aware, and she was very happy with the bridge. This model here, oh my gosh, I don't even know why I put this on there. This is just examples of like crown preps. Like when you have a tooth, you have to like shave it down significantly so you can like put a crown over it. And this is just my model from that. So the bridge basically held on by this tooth here and 3 teeth on this side, and then it just replaced the things in the center. That's pretty much it. Okay, this is the same patient, and she lost all of her teeth posterior to her lower right canine. So that's like really 4 or 5 teeth that she lost, and she wasn't able to chew. So again, like, you know, allowing patients to function and be able to chew is very rewarding. So what we did is we actually placed dental implants, and we did a bridge, an implant supported bridge. So when you get implants placed, you put this thing called a healing abutment over it. This healing abutment helps shape the gums to make sure that when you do get your teeth in there, that the gum like looks natural. It's a nice like contour, and it's not just like flat and it like looks weird and not natural. So that's why you place healing abutments. And what I did, you remove these healing abutments, you take an impression, you send it to the lab, and this is a second step. It's called a verification jig. This is just a little piece that sits on top of the implants, and it basically just confirms that the position of the implants are accurate to the impression that I took. So if it fits perfectly, it means it is. If it doesn't fit perfectly, then you're in trouble and you have to go back a step, but that's fine. That happens all the time. And the bottom right, this is like what her final bridge looked like. So this basically went over this area, and this is, I wish I took a picture of it. I did deliver it to her. I wish I took a picture of it in her mouth, but I was like, you know, you'll be back. It's fine. And then COVID happened. So I didn't get a picture in her mouth, but she did get these teeth, which I'm very happy about because she could chew, and it just makes a difference. It was really good. All right. This is one of the cases I learned the most from. This patient he had trauma to this tooth, the tooth that should be here, and this tooth here. And he fractured this one so badly, he had to get it extracted. The best option for him would be like one implant. Just put one implant and it's fine. He was so scared of the surgery, didn't want to do it. He wanted a bridge. And I was a little confused because I was like, you want one tooth to fit this entire space? Like, how is that even gonna go? He also has this thing called peg laterals. These teeth here are way skinnier and smaller than they should be. So I was just like, I have really no idea how to begin this case. So what I did is I took a model, I took an impression of what his teeth look like, and I poured it up in stone. And I did what we call a wax up. So I did some lab work, and you'll do a lot of wax up in dental school, don't worry. And it's like kind of annoying. But what I did is I actually made this with wax. I made this tooth bigger. I made this tooth bigger, and I made this tooth bigger. And I actually waxed up this tooth too. And I didn't want to start cutting his teeth when he had no idea what to expect and what it's going to look like. So what I did is I made a wax up, and then I made a stent out of it. And I put a temporary material in my stent and put it on his teeth without taking anything off, which is what this is. It's not beautiful, but I made this tooth bigger. I made this tooth bigger. I made space for this, and I made this tooth bigger. And I just put it in his mouth. It's called a mock-up. And I showed him, and he was like down. He's like, this looks great. I love it. And I was like, okay, well, I still think an implant's better, but whatever. And he really liked it. So what you do when you have a mock-up like this, you take a picture, you send it to the lab. You also take an impression of this, and you let the lab know that this is the patient's expectations. This is the size of the teeth that the patient wants for it. So the next step was to, you shave these teeth down for a bridge, and the lab has a better idea of like the shape and all of that. So he could have gotten a bridge from here to here. I told him if he did that, it's going to look really awkward. So he decided to crown this tooth too. It's not the ideal treatment option, but if you're really willing to help your patients out and try to kind of do your best, they will appreciate it. He loved this. I still thought it was like, okay, but he went with it. So this obviously this is not the final product, guys, but again, sorry, COVID happened. So I didn't get to deliver his final prosthesis, but these steps are so much more important than like actually doing that. And a mock-up is really important in general for demanding patients, so they understand what to expect. Because they'll bring their photos, they'll be like 60 years old, and they'll bring their photo from their like high school graduation and be like, make me look like this. And you're just like, I can't. And you get a lot of patients like that. So, understanding it's very important for them to really get an idea of what's going on. All right. So this is my favorite quote, and it's by Marilyn Monroe, and it's just, the sky is not the limit, your mind is. You could literally do anything. So I showed you a lot of like cosmetic, like crown and bridge cases, but I did an extraction of this tooth, and I did a bone graft. This was my first bone graft ever, and it really came out well. This picture right here, this is another bone graft I did. Like, I never thought I would do things like this, but residency, honestly, it opens the doors. You could do whatever you want. Here, I did a really hard extraction where the wisdom tooth was literally like right here. And this is the wisdom tooth when it came out. And I took a picture because I was like so creeped out by it. But yeah, this, I never thought I'd be into surgery, but I actually do surgery from time to time. And this, as you guys know, if you guys tuned in last time, it's a root canal. Mm-hmm. So honestly, you could do whatever you want. This case is probably one of the craziest things I've ever done. This patient here, these two teeth on your right, her patient's left, she had a lot of gum disease and the teeth were basically loose, and she really wanted implants. But the problem was that her sinus was so low that you can't place implants into the sinus because the sinus is dead space, and implants need bone. So you don't have bone, the implants are not going to integrate. So she agreed to taking her teeth out and getting a sinus lift. and I had never seen one in my life. I didn't even know what a sinus lift was, like what you do. So our surgeon was like, you should assist me. Like, it'll be a good experience. I was like, okay. So I removed these 2 teeth. This is like her healing about a week later. This is literally her sinus that was opened. And I can actually show you a video of her like breathing in and breathing out. And you can see the sinus like move up and move down. I did not do this procedure. I will be very honest. I was just assisting with it, but it was crazy and it was really cool. So I'm just going to share that. So this is basically her breathing in and breathing out. And what we did is we just, let me go back to this. So this is the sinus. What you do is you just take it and you push it up and you pack bone into the space. So you're lifting the sinus and you're replacing it with bone. So when it's time for an implant, the bone is maturing and you can place the implants. But God bless oral surgeons. That's all I'm going to say. Alrighty. All right. And honestly, that's it. I tried to go over a little bit of everything, but I'm very open to answering any questions that anyone else might have.
That was really great, Dr. Shah. Thank you so much.
Yeah, no problem.
So I'm going to read out some questions that people left in the chat, if that's fine with you.
Yeah.
Okay, so is there a minimum time commitment for working for a corporate dentist, like a minimum 5 years work, and then you can look for private practice?
So corporate, you usually will sign a contract, but most contracts have a loophole where it's like they can let you go or you can leave at will. You usually have to give X amount of days of like notice. I have a friend who's in a contract for 3 years, and she is using those 3 years to pay off her student debt, and then she's probably going to look for something more private. So yeah,
So it's not like binded.
Sorry?
It's not like a binded contract. You can leave if you just give them notice.
And I would recommend don't just sign anything. Like really read it and modify things if you feel like it's unfair. Right. Sure.
Yeah, for sure. Do corporate dentists charge patients with no insurance more than a private practice would?
That is a good question. The small corporate I worked at was in Midtown Manhattan, and now I'm practicing in New Jersey. So if you were to compare them, yes. But I think more than corporate, I think it depends more on the geography. I'll be quite honest. I think it depends on like what the average price is for something. Because think about it, if there's a corporate in like one town and then like 3 blocks away, there's a private practice, the private practice would basically get all the patients if the corporate was charging way more. So I think there's like some type of rule where like you have to be within the local like market. You can't like charge way more for something.
You can't just like make up your own prices.
It's based on that would be so nice if I could, but no, you cannot.
How would you recommend approaching a dentist for shadowing opportunities? Are dentists allowing shadowing during COVID?
Okay, that's a good question. I honestly, what I did is I asked around friends, family, if they knew someone's uncles, sisters, whatever, like I tried to like develop a connection. I shadowed 2 people that I kind of got based off of connections. It wasn't like a random person. I did reach out. I literally, this is ridiculous, but I literally went to every dentist in my town and like dropped off a letter saying that I'm pre-dental and I'm very interested, and they never got back to me. So I don't know if it will change now. I think with COVID, it's a little bit difficult just because they're trying to limit how many people are in the office. But if you really have a lot of time, you could always ask them if they're willing to even train you as an assistant, even if it's just turning over rooms and, bringing patients in, like anything. And if they're willing to kind of let you do that, then maybe, if they're also getting something out of it, maybe they'd be more inclined to. But I would definitely ask like friends and family, like if you have a friend whose dad's a dentist, like they'll let you shadow. I mean,
Yeah, for sure.
I'm an employee. I don't have my own practice, so I would kind of feel awkward like asking my boss, like, "Hey, like, can someone come and shadow?" But if I got like super comfortable and I was working at one place for a couple of years, then like it's easier to do that. But definitely ask around.
Like ask a lot of people.
Yeah,
Email.
definitely. If you can develop any type of connection, I think that would be the easiest way to do it.
Even like internships and all that stuff looks really good on the resume when applying to like dental schools.
Absolutely. If you worked as a dental assistant, like I know people who had a gap year and they worked as a dental assistant and they learned so much. Like you will be way ahead of the curve if you like work as a dental assistant. You're going to know instruments and you'll know how to like x-rays and all this stuff. Like you take your own x-rays in dental school, you don't have your own assistant. Like you have to know how to do all of that. So
So yeah, you'll be a lot more comfortable.
absolutely. Yeah,
Sure.
I would recommend it.
Thank you. How would you recommend approaching a dent? Oh, I just said that. What do you wish you would have? What do you wish you would have known prior to going to dental school?
Oh man. That's a very good question. Um, I wish I knew how much you really have to practice to develop your hand skills. It is very hands-on, and honestly, I'll be very honest. I'm great at didactic stuff. Like I could like read something once and I'll like ace the test. But dentistry is so hands-on. So I would like in my curriculum, I think I practiced 80% of my day would be practicing and 20% would be like studying for things. Like I practiced a lot and there's still things today where I'm like, oh my gosh, I need to get better. And I will always push myself to kind of develop the skills and, go in that direction. But if you're not like if you
Hands
don't have
on.
like that many hobbies where you use your hands a lot, like manual dexterity, it takes a toll on, it's very important for dentistry, but it takes a toll on your body. Like I'm always having a neck pain. I'm always having backache. Like I'm just like, oh my God. But that's just kind of how the field is. So yeah, it's very
Thank you.
hands-on.
If you are part of corporate dentistry, in how many years will you be able to pay for all your debt?
So corporate dentistry is very big on incentivizing things. Actually, private practices too. So how your model is very commission based. You'll get most corporations will tell you they'll give you X amount of dollars guaranteed for the day for your just the fact that you were there. If you make if you make like more than a certain amount, you get a percentage of that. So just explain it this way. If you were guaranteed $500 a day, for example, and you produced, that's what they call it, they call production. If you produced $1,800, you may get like 35% of 1,800. If it's higher, it might not. If you do the math, it might not be, but I'm just giving you an example, like $2,000, right? So 30% of 2,000 is 600. So you would get the 600 instead of the 500 for that day because you produced more. But you get you get a percentage. You don't like take home 1,800, which would be amazing. But so it's
That's
very
true.
much based off of how much you can do, how fast you are, and yeah.
How productive you are.
Hmm. Absolutely.
Do you have any advice for dental students due to the pandemic and having a very condensed timeline?
Dental students or dental like pre-dental?
Like pre-dental students.
Um, it is definitely very unfortunate that like you guys are trying to apply to dental school at such a bad time. But what I would recommend is definitely have the numbers. Like that's number one. Like make sure your DT and your GPA is great. If it's not, figure out what you can do to make it better. Number two, um, try and see like what type of extracurriculars you can do to make yourself stand out. Like dental assisting is a thing. Shadowing you need for your application, but you kind of need to think about what you can do that's like a little outside the box. So assisting, if you can maybe even do something like a study club and like get together with other pre-dental students and kind of talk about dentistry and like, I don't know, like how, and then kind of, like what you guys are doing now is like really good because you're trying to understand the field to the best of your ability. But like I was saying earlier, it's so hands-on that it kind of limits you guys a little bit, but I wouldn't give up. I would try to develop hobbies that require hand skills, like making jewelry, knitting, like
Instruments.
yeah, instruments. I mean, I decorate cakes. I don't know. That's just like my thing. I love baking, by the way. I'm terrible dentist. I eat so much sugar, but yeah, like try to work on that. But it is really a tough time. But I think if you show your passion, your compassion, your willingness to grow, I think it could definitely put you ahead. Another thing, try to read dental journals. Even if it's like if it's a topic that you don't understand, don't read it. But there's a lot of like public health literature out there where you can really learn like how the government, for example, is controlling dentistry or like how states are controlling dentistry. Because if you do have an interview, which I hope that you guys all do, like that's like a really cool conversation to have because people would just be like, oh, like how do you know that, So I think that's also another thing that you could do.
Thank you. We're gonna do two more questions if that's fine with you.
Sure.
Do you need an associate's to become a dental assistant, or could you ask to become a dental assistant after getting a bachelor's in biology?
It depends by state. And it also depends on what you're going to be doing. Some states will require a x-ray license. So you may not be able to take x-rays, but I know that like a lot of the times you can just be trained by like other assistants, especially if it's short term. But you have to kind of check based off of where you are. Because unfortunately, I never did that. And the reason I'm stressing it so much is because that's like the one thing I wish I did before I applied.
I've heard a lot of pre-dental students. Oh, sorry. I was just gonna say I've heard a lot of pre-dental students like with the dentist that they shadow, they train them to become dental assistants like on the job, and then they get the job for like a year or so.
I mean, it's amazing. And honestly, there's so many dental assistant jobs right now. So they might be very desperate to do that for sure. I mean, I've seen it. I don't know if anyone's from Jersey, but like I was once going through a job posting and they were like, oh, like unpaid internship for anyone trying to pursue dentistry. And I was like, what? So it's a thing. Even front desk, if you can't do assisting, learning like how to run a front desk, like I mean, get a little bit of everything. The more time you spend in a dental office, the better it is.
That's true, yeah. And then the last question, how was your transition going from clinicals to seeing real patients?
So LECOM is really nice because we got our first patient in our first year. We did like a full, so we actually learned dentures before we learned anything else. And we did a like pro bono denture case to the patient. So it was like a free denture for the patient. And we did that as a D1. D2 year, we did our second denture case. Same thing. Like it's like a pro bono type of thing that we were just doing to help our community. D3 year, that's when you go like full on, like that's like the worst year of your life, guys. I can't. I'm like trying to think about it and I'm just getting like PTSD. But because you have to do all the didactics, you have to take boards, you have to take your licensing exam, and you're new to like the clinical practice. But I had a really good group of friends in dental school, and we would kind of like go over our schedules and be like, oh, I have this filling tomorrow. Like, what is your go-to? Like, how do you do it? What do you check for? Like, what do you do? And then we actually watched a lot of videos. Like we would just sit down and be like, okay, like this is a good video. Like, let's do it this way. Let's do it that way. So your friends, you need to have good friends in dental school. They will literally help you and like get you through. That's just the kind of person I am. I need to talk everything through. To this day, like when I have something that I'm nervous about, I will start panicking like a week in advance and bother like every single friend that I have. So it's just something like if you're be overly prepared for everything and expect the unexpected. Like you could be planning for a filling and it turns into a root canal and you're like, oh, I guess I need to do this now. So definitely, you know, keep all those things in mind and really try hard to watch things on like videos as much as you can. I'm not promoting YouTube University, but they have so many good things on there. So I think that's probably the best way to see it and discuss it. And the hand skills will come. You'll always have attendings watching over your shoulder. You get 3 hours to do every single procedure, which is like amazing. So you'll, I think you'll be well prepared for that.
Thank you.
I think we can do one more question. So time.
Okay. Does Dr. Shah have any advice for students who are struggling in biology classes but are really passionate about becoming a dentist or orthodontist?
Sorry, can you repeat that again?
Does Dr. Shah have any advice for students who are struggling in biology but are really passionate about becoming a dentist or orthodontist?
Okay, so I would pursue maybe a post-bac. First of all, figure out why you're struggling in biology. Figure out, is it the way that you're studying? Do you feel like you're not putting enough time? Is there things that just don't click with you that you wish you would be able to understand better? Get that help early on. Like figure out, you know, what you can do to do better. If it's kind of too late and you like have a bad grade in bio, I would consider maybe doing like a post-bac program. You basically just, you know, it's kind of like doing a couple of classes of undergrad again. See if you have any opportunities where you could take bio again and they like average out your grades. Is that a thing? I don't know. But I think it was like back when I was in college. Like see the opportunities.
I think
yeah.
I think it just depends on which university, but for sure it's a good idea.
Yeah, and the most important thing is figuring out why you're doing the way that your performance is that way. I actually didn't know how to study until I started my master's degree. Like I really struggled with figuring out a study routine that worked well for me because I was trying to do everything, and like you eventually just realize what works best for you and you follow it, and then all of a sudden studying is like so second nature to you. So definitely.
That's very great advice. Thank you.
Mm-hmm.
So I think you said you have the attendance quiz ready.
Yeah, I have the attendance quiz ready. So I'm gonna post it in the YouTube chat, and you guys will have about an hour to complete it. So 8 o'clock Eastern time. But I'd like to say thank you to Dr. Shah for coming. You know, we really appreciate it.
Thank you so much, Dr. Shah.
Yeah, thanks for having me. Of course, you guys have my contact information. So if you ever have any questions, please reach out. I'll try to help as much as I can. And, you know, it would make me very happy to help someone get into dental school, or like all of you guys, if that's even possible. I don't know.
Thank you so much.
Yeah.
Thank you so much, Dr. Shah. I hope you have a great night, and I hope everybody has a great night. And we'll see you at our next session.
Thanks for tuning in. Bye-bye.